So what exactly is the effect of the new mutations, and how can we best prepare for them? Joining us to discuss is Professor Manfred Green, Director for the Masters in Public Health program at the University of Haifa. Professor, thanks again for being with us. Now, we have seen a rapid spike in infection due to the UK variant, especially in kids now. How will this affect Israel's morbidity and the rate of the spread of the virus?
Well, maybe today I'll talk in a more positive tone, even though there's all this increase in disease. The virus mutates, and we know that it mutates. It's one of these RNA viruses that mutate, and we'll see mutations all the time. What we really need to do is make sure that our vaccination campaign goes as fast as possible, and it's going very well. And the public have to understand that they should be cooperative and, maintain social distancing and masking, even though I know we're under lockdown, but, take extra care, because as long as the virus is circulating, as long as it's going around, even if it's not causing much disease, in other words, not much serious disease, it's going to mutate. And that's one of the issues we need to deal with. So basically, we need to do the right things, and I think we can do that.
Are the facts that you just laid out, should they be factored at all into the exit strategy, for opening the economy?
I would say so. I think that there's obviously this pandemic fatigue and a lot of things. I think that I would suggest the following. We know that we're going to go out of this with a lockdown at some stage and this gradual change. But I think that we need to then give the public more positive things to do. And one of the things that I would suggest is, for example, to prepare for a different kind of environment where we can make sure that we are social distancing and so on, for example, in the schools. And I think that should be a tremendous emphasis on now reorganizing the schools so that there are ventilated rooms, much more space between the students, and thinking creatively about how we should do this and involve the parents in the planning.
All right. Now, as with many new treatments and new illnesses, there's a concern that the virus, and in other cases, typically bacteria, will become resistant to the treatment. That there will be some sort of Israel variant caused by the fact, or that will be resistant to the vaccines because so many Israelis have been vaccinated. What do you say to those concerns?
Well, first of all, it's not an issue of treatment, because we're talking about vaccines. It's not like a bacteria, or at least in this particular situation, viruses can also become resistant to treatment, but we don't have too much. But for the vaccine, our concern certainly is that the virus will be less neutralized, shall we say, by antibodies produced by the vaccine. But these vaccines can be modified, and we can give boosters. So that's also something that's not beyond us. In other words, and the companies are preparing for that. So, we go again back to the thing. If we have a high percentage vaccinated, lower the circulation, we're going to then be in a much better situation to deal with the mutants and not create new mutants.
All right. So now I want to kind of talk once more a little bit about the current lockdowns. Israel is closing all the borders, especially the airports, as Netanyahu called it, a hermetic seal around the country. Is that going to be enough, or are we really going to be seeing this virus hanging around us, as Health Minister Edelstein said, for the foreseeable future?
It's going to be around for a long time, but we can live with it and we can deal with it. And I think we need to encourage the public really to do the simple things. I know there's a tendency to say, well, if we don't do anything or we do a lot of things, it's not going to make a difference. But there is that middle road. And I see it where I'm around, the fact that a lot of people are not wearing masks the way they should in public places. And having these gatherings, we can do that, and we can do it in a way which makes our lives much better and much more normal. So I think, and combined with the vaccine, I'm convinced that we're going to get into a much better place.
All right, Professor Green, thank you so much. It's been a pleasure as always to have you.
Okay, all the best.